When we're in pain, we have a tendency to stop moving, or at the very least, reduce our movement. And though this can be the right thing in certain extreme situations, where when we need to give our body a chance to rest, it does benefit us. It makes us more able to recover in certain situations. However, the science behind pain and movement and their relationships are showing more so that in the cases of chronic pain, we actually need to continue to move regardless of that pain, safely, slowly, gently, as necessary. But we still need to keep moving. And as we keep moving, when we build the strength in our body, we actually help to balance the sensation of pain and then reduce some of the things that in fact cause pain. So when it comes to movement, there is a special relationship between that and pain, and it's one we all essentially know intrinsically. So we move and we have sensation of that movement. There is a sense of movement. We call that proprioception, we call that mechanoreception as a technical term. And what happens when we do that is that sensation is fed back into our nervous system. And that's really cool. But the thing is that sensation has a modulatory effect on pain. And this is exactly the same as when you rub your leg after bumping it on something. It helps to block out that pain. So that nervous system will start to inhibit this sensation of pain. It will block that pain. It will block, in fact, some of that pain, not all of it. Not all of it. It's very important that it blocks out some of it, a fair amount, in fact, because it makes us have the ability, when we're injured, to continue to function, to continue to run away from the thing that maybe hurt us or get to a safe place. If we can't focus on the movement of our body, we'd fall over a lot, and whatever's trying to eat us might get to us. So some of that pain is blocked by moving around, and this is good to know because it means that exercise can help us manage pain if done well. The causes of pain are also of great interest to us. Strain is certainly one. Degeneration of the tissue, that's breakdown of the tissue. And in fact, immobility of tissue, all can come together to create pain. And to get technical again, this would be chronic pain, in these three examples, chronic pain from C fibers. And they tend to be your dull, achy types of pain, which tends to last long periods, can go through different phases, up and down, different severities and intensities. But these things are what actually can cause some strain, degeneration, and immobility. So whatever we can do to get rid of them, perfect. When it comes to actually moving and building strength and coordination from our movement or our exercise, this has a number of positive effects on the body. Positive effects we really should be taking advantage of, whether we're in pain or not. So building strength and coordination actually builds something called balanced tissue tension. And tissue tension is our ability to hold ourselves up. We are always having a little bit of tension, a little bit of contraction going on at all times throughout our body, and it's very necessary that it does this. This helps with certainly blood flow and fluid flow and all those kinds of things. But as well, it makes sure we can withstand gravity and we can withstand different forces, walking, running, anything like that. We always must have tension in our body, but it must be maintained and regulated and coordinated. Another thing that actually happens as we build strength and coordination, we build up a better capacity for blood flow. And that is both on the venous, lymphatic, arterial ends of blood flow, the entire cardiovascular system. It's not just the heart getting stronger when we use our muscles. Our skeletal muscles actually do a good job of helping us pump the other fluids in our body. And as well, it turns out as we load our bones, there is a hormone secreted, and I'm not going to get overly technical, but it's called osteocalcin. It's worth looking up. But it turns out as we load our bones, this hormone is released. It is not necessarily relevant to growing the bone itself, but it does stimulate a lot of function in hormone organs. Hormones like insulin are affected by it. Growth and change in the body is affected by it. So that strength and coordination we're building actually has a total body effect. So like we said before, movement feeds back into the nervous system. That sensation of movement helps us to reduce some of the sensation of pain, which is fantastic, because if we can be calmed down by movement, the other benefits can happen. Balanced tissue tension, blood flow, hormonal changes. And it turns out it actually gets better, because balancing tissue tension, in fact, reduces strain. It takes away some of this strain in the first place. Better blood flow and balanced tissue tension, all of that actually take care of degeneration and immobility as well. They can help to reduce these things. These things can be reduced simply by the fact that the body is more balanced, moving better, and has better blood supply. Thankfully, the human body is always being rebuilt. And the fact is, it's not a short process. Building up the effective amount of exercise to help you in life to feel better, deal with your chronic pain, and in fact be better does take a lot of time and effort. And really it takes a lot of upkeep over a long period of time. Building up the necessary strength and coordination through exercise is something that takes really a lifetime of work, because we're always falling apart, but we're always being rebuilt. And you have to encourage that rebuilding in the right way. This has been Elders from Simple Lines Anatomy. As always, I hope that made sense.